Hi and welcome. This is Sbba Siddique, and this was supposed to be the UK leg of the World Ovarian Cancer Coalition's Instagram takeover from the UK by me, but technical difficulties meant other plans have had to be put into place. So Liam and I are about to do this over Zoom. So the purpose of the Instagram takeover was that, all day long, advocates, survivors, caregivers were going to be going live across the World Ovarian Cancer Coalition's Instagram page, sharing their experiences, raising awareness. I know we've already had a couple of Instagram lives already. We've had Shubna Gujada from Australia, and we've had the Ovarian Cancer Malaysia team as well. And now you were supposed to hear from me on Instagram Live, but it just didn't happen, and my UK guests. Um, so I'm delighted. I was supposed to have two amazing guests with me, but I think it'll now only be one. But we may get the second popping their head in, hopefully. So joining me is Liam Desai. Hello, Liam. How are you?
I'm good, thank you. How are you?
Just a bit stressed, but it's okay. We're here. That's the main thing. Now, Liam sadly lost his mum, Anita, earlier this year to ovarian cancer, and that was after a 5.5 year long battle with this awful, awful disease. Um, I'm having navigated an ovarian cancer diagnosis myself. I know it's not a great place to be at. But from what I've read about your mum, she sounded like an absolutely gem. Gem of a person, gem of a human, huge heart. Tell me more about her.
Yeah, no. Yeah, just as a rough recap, she was diagnosed with stage 4 ovarian cancer in July 2019, and from there on had a 5.5 year journey with four reoccurrences, and then sadly passed away in February this year at the age of 61. But yeah, it's just to touch on her personality and what she was about. She was an amazing woman, the most bubbly, vibrant, social, caring person ever. We realized this when we were planning the funeral that we didn't realize the amount of people that wanted to come, and she just
Mm.
made friends with anyone that she'd come across, and maybe that was her way of spreading awareness. I don't know, but yeah, she was amazing, and she's definitely the front of our family, the face of it, and the one that made the most noise. And we're definitely missing that in the last two
I
months.
also
But
I also think that's generally kind of like a mum thing anyway.
yeah, 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 definitely, definitely. But
'Cause you know what you boys are like. You're quite, bad at showing your emotions and like it is kind of like a really mum thing to do. And she sounds amazing.
yeah, no, no, she was, and I think when we take a bit of perspective to think about what she went through, it's pretty amazing, and I guess that touches on her personality as well. That she's very resilient and just a true warrior. I think she went over under roughly 50 chemo therapy sessions and had a debulking surgery
Yeah,
for a stoma,
yeah,
um, and then went through a trial that didn't work as well. So yeah, she was very resilient, and I mean, throughout this whole journey, she was just so selfless and wanted to make a lot of noise for other people.
yeah. Now I've read Anita's story, and as I said, she sounds like an absolutely incredible woman. But it took you 2 years for mum to be diagnosed. Um, and this is something that we repeatedly hear from other ovarian cancer patients that, there is misdiagnosis, that they are fobbed off, especially if you're in your 50s. It's, because it's a disease that is masked, and the symptoms can relate to other conditions. How challenging was this time?
Yeah, no. In 2017, she started having some issues that she was going to the GP for, and that lasted obviously up to 2 years to the diagnosis in 2019. And I guess from my perspective, being 17 and just finishing school and going to university, I don't think I fully was realizing what was actually going on at home with mom. Maybe because she didn't tell me much either. But I knew she was going to the GP. I knew she was having issues with like persistent bloating, backache, weight gain, and just digestive issues. And yeah, she got the same answer that um, have some IBS tablets. It's just that, and the weight gain's due to menopause. Um,
Bingo. That's
yeah,
exactly what I was told. And it's really sad that women are being dismissed in this way repeatedly.
yeah, and I mean, from our perspective as well, like we're not thinking about ovarian cancer at the time. We don't really know much about it. So you kind of just listen to your doctor and you're like, okay, yeah, sure, it's something that's more minor like that and treatable. But yeah, no, I think the real challenge is looking back at that and realizing that there was 2 years of that and could have been quit sooner, and who knows what could have been different. But
Yeah,
yeah, so after diagnosis, obviously spoke to mum a lot about it, and she mentioned that what the GP had said after diagnosis, that they did do a CA-125 blood test on it in that 2 year build-up because
yeah,
they were concerned about some of the symptoms and whether that was linked to ovarian cancer or cancer similar. But they didn't follow up on it, didn't tell mum about it because it was less than the mark was less than 35. So it's it's difficult because people that aren't aware of what it is, what the symptoms are and stuff, it does just look like IBS, and it's a shame that it can just get forgotten about. And I guess that's why it's called the silent killer. But yeah,
yeah,
no, it was a very
yeah.
challenging time, and it's tough to look back on what could have been different.
Absolutely. I'm going to welcome Professor Christina Fatopoulou to the conversation at this point. Thank you so much for joining us. My apologies for all the technical issues we've been having and having to come over to Zoom to do this.
Don't worry. Don't
Welcome.
worry. Pleasure to be here, and thank you for having me. It's my honor. Thank you so much.
Absolutely. We're going to have a couple of more questions for Liam, and then I will come over to you if I may, if that's
Yes,
okay.
of course, of course, of course.
Perfect. So, Liam, now I know from my own diagnosis, the whole ripple effect on the family and caregivers is, and that's huge with any cancer diagnosis. So the impact on loved ones is big. How did you as a family navigate this?
Um, yeah, I remember the first day so clearly when mom came back and told us that it's stage 4 ovarian cancer, that um, 6 weeks to live without treatment, 4 years with treatment, and it was super scary. I think we were all speechless, and it was hard to digest at the time. But when we got past that and we understood what was going on, we're a close family as it is, just a family of four of us, and this whole journey's brought us even closer, and we just
Yeah,
stuck with each other through the whole thing. I think one thing that was easy for me to say because it's not me going through it, but it was just trying to preach positivity and
yeah,
keeping a strong mind, not letting it get to you as hard as that sounds, and just tackling it one bit at a time. And yeah, that's what we did. My dad and my brother are both very smart men. They're very into their research and stuff. So
yeah,
we weren't just going to doctors and listening to them. They were doing a lot of research, trying to understand it themselves,
yeah,
trying to understand what treatment options there are, and trying to take that weight off my mom's shoulders a bit,
yeah.
just so she could focus on what she's got to tackle, and we can kind of just be her team and carry on.
Now I know throughout her 5.5 years, coping with the OC, that she was a really strong campaigner, and she championed ovarian cancer. What motivated her?
Yeah, I think just life, to be honest, life for
Yeah,
her, life for others. I think when, like a lot of other women would have had, when you get hit with this news, you probably go to different forums like groups on Facebook and stuff, read about other people, and I think you just become part of that world. And I think that introduced her to cancer influencers like
yeah,
Deborah James,
yep,
big inspiration to many women, including my mom. And I think that kind of kicked her on to be a bit like, well, if I'm going to go through this, I should document this. I should try and help and show people the ups and downs, the whole journey. And I don't think she realized at the time how hard it is to get as big
yeah.
of a following as Deborah James. But she tried her best, and to be honest, she had a crazy amount of friends and made a lot more through this whole journey. So she was definitely well known and loved. But yeah, she documented everything on her Instagram. Kept it real with everyone,
Yep,
and was very vulnerable on there. So
yep,
she just wanted to make a difference, and then worked with Target Ovarian Cancer
yep,
a lot. Did a lot of short films, brief articles about her story, and even last year in their new village held a talk with all her new neighbours with Target Ovarian and did a speech in front of everyone when she just found out she had another reoccurrence. So I mean, yeah, she's definitely an inspiration. We're very proud of what she did, and
yeah, rightly
obviously
so.
must trying to carry that on.
Yeah, rightly so. She sounds like an absolutely amazing person. I know as a loved one of someone who's been through this terrible disease and you've lost them, what's the words of advice that you would give to anyone that's been diagnosed or, their loved one?
Um, I think, yeah, just again, it's easy for me to say, but just try and stay positive and try and keep that strong mind, talk to each other, be open with each other. and try and just read as much as you can on it as well.
Yeah,
Medicine's advancing so much, and I think one thing we had with mom was like, yes, we're told it's incurable and stuff like that, but if we can keep just prolonging it a bit, new stuff can come
yeah,
out. And there were a few new things that mom did try. And
yeah.
look, it's a journey of seeing what works and what doesn't, and trying to help the future by finding that one that does work. But yeah, just talk to each other, read up on it, and yeah, it's important to just mention it in your social groups. I mean,
Yeah.
I'm 20, I'm 25. I know they try to say it's something with older women, but we know younger women can be diagnosed with this as well. So I think it's important people as young as me can talk about it as well.
Yeah.
Um, but yeah, just be the best support network you can for your loved ones.
Amazing. Liam, thank you so much for sharing so generously. Your mum would be absolutely proud of you.
Thank you.
And I wish you and your family all the best.
Thank you. Thanks so much.
You're welcome. Let me now introduce you to Professor Christina Fotopoulou. I don't even have to introduce this wonderful, wonderful woman. She is a leading consultant gynecological oncologist, Faculty of Medicine at Imperial College London, and she's also the Deputy Director of Ovarian Cancer Action Researchers Centre, all around angel human being who has helped and supports so many women through their ovarian cancer journey, including myself. And I am grateful for my both of my surgeries were with you. And it's a great pleasure to welcome you.
Thank you. It's my great honor. I mean, there is no better honor and pleasure for a doctor to be with the patients, to see a patients doing so well, being so proud of them, and being so brave to keep their journey. I mean, this is what gives us strength. Women like you gives us strength to just keep
Oh,
doing what we're doing and to continue our journey, because the journey is also for us.
absolutely.
I know that it's I mean, we also need strength, we also need courage to continue despite all difficulties, which are not few.
No,
So thank you for that. Thank you for giving us the strength.
no, you're absolutely welcome. And I'm so pleased to have you here. So tell me, Professor, tell me, what does a typical surgical day in the life of Professor Christina Fotopoulou look like?
Ah, so after I bring my kids to school, and after I wake them up and give my daughter milk, I will go to surgery. I will see some patients. I will operate if it's a surgical day. Ovarian site reductive surgeries are usually long surgeries, so they may be from 2, 3, 4, 5 hours. So it may be that I will operate late in the evening. I usually will try to always see, because the turnover times between two cases, because patients need central access and spinal, it may be an hour or even more. So I try to always use this time to see other patients, so I don't rest this time, so that I maximize time efficiency. And then at some point around 7 o'clock, I finish and then go back home to work on my laptop. That is a typical day.
The joys of motherhood and full-time work, I guess.
Exactly, exactly.
Exactly. So now, really huge and broad questions. Should all
Mm.
patients with ovarian cancer undergo radical surgery?
So that is a very important question. So all patients with ovarian cancer should be considered whether they are eligible for radical surgery. Yes.
Yeah,
But not everybody will be eligible. There are patients who are very frail, who we need
yeah,
to get stronger first. There are patients with very extensive disease or even inoperable disease, inoperable meaning not just too difficult to resect, but for example, lung mets, brain mets, liver mets that cannot be operated, where we need to divert to non-surgical options first. Patients with relapsed ovarian cancer, not always when the cancer comes back, needs or has to have surgery. So there are
mm,
many different scenarios. So what I always say is that every time point of a patient's journey needs consideration whether surgery is an option, but then it varies whether it is indeed an option. But it needs to always be considered, and so that patients don't miss the opportunity and don't,
yeah. I
have
guess
the
it,
maximal treatment
it's
possible.
yeah, and it's exactly having as many options on the table as possible. Um, Now, I mean, we've heard from Liam just a little bit earlier on. His mum, Anita, had four reoccurrences during her 5.5 years battling. Statistically, reoccurrences with ovarian cancer generally are high. What's the reason for this? And is surgery in the case of reoccurrence the best option?
Yeah. So ovarian cancer likes to come back again. That's what I always try to say to my patients, not to scare them, but to prepare them. It's always better if you're prepared to what comes ahead of you. So ovarian cancer likes to come back again. And the minute it comes back again, it usually remains a so-called chronic condition, or else defined as incurable. Incurable is a very difficult word because who of us is cured of everything? We are all incurable of everything. Yeah. I mean, we all live on borrowed time, and I wear glasses. I'm incurable of, so, incurable is a very difficult word. So that is why I prefer the term chronic condition. So when the cancer comes back again, usually it will come back again. There are cases of solitary lymph node metastasis, very rare reoccurrences where patients can be cured. Yeah. But the rule is that it usually will come back again once it has come back once. So surgery is not always an option. On the contrary, in a small proportion of patients, surgery will be an option when the cancer reoccurs. There are very strict criteria according to which, and algorithms according to which we determine whether surgery would be beneficial for the patient, because as you know, and also as Liam knows, surgery can take a toll on you. So we need to be very careful before we expose the patient to such risks. Yeah, we need to be very clear of the benefits. We need to have stratified evidence of benefits. And nowadays we really have surgical studies that have proven or not proven the benefit of surgery. So we need to follow these rules. And we have now guidelines. I'm very active in national, international guidelines. So nowadays the surgeons are not like in the past where they would just do whatever they think or whether they think it's possible. And yeah, I'm the best and I can operate that. It's far away from that. We really have guidelines, SOPs, consensus statements, according to which we stratify our patients to the right treatment pathways.
Yeah. I mean, I don't think I'd be wrong if I say that most women come to an ovarian cancer diagnosis with very little information. I know I certainly did. I'd never even heard of ovarian cancer before I was diagnosed. And you have to really become quite an expert yourself. Like Liam said earlier on, his dad, his brother were doing a lot of research and investigation. And surgery for ovarian cancer is quite difficult. There is a lot involved, and the after effects as well, and recovery is quite long. Are NHS patients entitled to a second opinion on whether surgery is the best option?
Yeah. So first of all, to start with your first point, of course, patients with the first diagnosis of ovarian cancer do not know a lot about the disease. Even if I would get now, I don't know, another type of cancer, I wouldn't know much about it. I would have to read about it, even professionals, even if I would, and it's impossible for a layperson, even for a professional, to know everything about all diseases. It's impossible and it wouldn't be right. I mean, that's not a miss. Yeah, that's not something that you have missed. So it's a decision of every patient whether once they get diagnosed, they want to know more. There are patients who don't want to read, the patients who say to me, listen, Christina, I don't want to know anything, just do whatever you think is right. So, and there are women like you, like Liam's mom, who read about it, engage, want to engage others. So there are many different ways to face this challenging condition. Yeah. And not to read is also an option sometimes, but it's absolutely not a miss when you first get initially diagnosed not to have heard about it. Yeah, that's not something that is uncommon. So in the UK, we have the lack of having a so-called centralized cancer care system. This means once you get the diagnosis or the suspicion of ovarian cancer, your team is obliged to send you to a cancer center to be treated by an ovarian cancer specialist. I mean, I was in Berlin yesterday. In Germany, anybody, they now start to do a centralization of care. Anybody, the obstetrician who will do your cesarean section can operate the next day an ovarian cancer patient. Yeah. So, and this is the majority of the cases in Europe. So we are very lucky already that ovarian cancer patients and gynec cancer patients in the UK will be directed to a specialist. Yeah, per definition. Now, there are more challenging cases than others. There are cases with the second, third, fourth reoccurrences where you need a bit more expertise of within the already expertise. That's not a shame. That doesn't mean that your initial cancer center is bad. It's just that, I mean, there is super specialization of centers. For example, I was yesterday with my a very good friend and colleague who is the chief of neonatology here in Berlin, whose expertise is all the neonates smaller than 800 grams. So, of course, this doesn't mean that all the others who treat a baby with 900 grams, they are bad. It's just that there are small expertise. We are also specialized nowadays.
Yeah.
So, within the NHS, you are entitled to a second opinion. Within England, you are. For some reason, which I don't understand because I'm not English, I'm not British citizen. It's that a Wales NHS patient does not have access to see me in the NHS, neither a Scottish one. Which is a bit strange because, I mean, UK is UK after all. So they have to do extra funding and request extra whatever. But within England, you can say, I want a second opinion, or your doctor can say, listen, Sbba, this is a bit too tricky. Let's refer you to another center.
Yeah.
That applies for surgery, that applies for clinical trials, that applies for targeted agents. And that is good so, because we all work together and we all network together.
Absolutely. Now, we all know ovarian cancer symptoms generally are quite vague. Most women tend to be diagnosed at a late stage. I mean, I certainly was. I was diagnosed at stage 3C, and many via an A&E admission. What can we do to facilitate change into earlier diagnosis and to change this?
Exactly. So early diagnosis can be often an illusion just because ovarian cancer, the way it starts from the fallopian tubes, the majority of the cases.
Yeah.
So it starts in an organ that is not accessible to, let's say, like a smear test or like a colonoscopy. And it only gets apparent when all the little cells that are on the fallopian tubes have already jumped out of the fallopian tubes, have gone on the peritoneum, which is the skin of the tummy, and have become so big that they start to create symptoms. So it's very difficult to diagnose it early, like in stage 1. However, what would be very important would be to diagnose it in a lower tumor burden. So not huge tumors everywhere, but smaller ones.
Yeah.
Yeah, even if it's a stage C, as you know, stage C can be because of a tumor on the omentum, so somewhere in the tummy, or tumor everywhere. It's both stage C.
And
so
I
think
the fact that there is no viable screening tool doesn't help the situation
exactly.
either. But there is brilliant work going on. You've got the work that, Dr. Ahmed is doing at Oxford with regards to ovarian vax, and, there are other projects in the pipeline too.
There is a lot of work. I think one of the main problems that we see is the accessibility to GPs.
Yeah.
It's not easy to get somebody. I mean, I'm also a patient myself, not of ovarian cancer, but I also need doctors, and to go and see my GP is not. It's easier to take a plane and come to Berlin, or to go to Athens. No joke now. So I think we need to have a system where it's not a bottleneck. So we have the GPs, and when the GPs they have a problem, they have to send the patient to the hospital. There is nobody in between for an NHS patient. So there is nobody. There are so few community gynecologists that could see you. So there is a bottleneck of the hospitals where a patient needs to be seen in a hospital, which is not really necessary. So I think what needs to be changed is the whole system. We need to have mediators. We need to have people in between, like perhaps we have in Europe. Yeah.
Hopefully the plans that are underway with the 10-year National Cancer Plan, where they want to encourage more community involvement in care, maybe that will help along those lines.
Yeah, that must help. And we need, of course, more people who are willing to do this, to be a community gynecologist.
So
there is a lot of restructuring that needs to be done.
Yeah, for sure. So what would your tips be for patients who have undergone surgery, post-surgery, that will aid and help them with recovery, not only physically, because a cancer diagnosis isn't just limited to the physical that you go through. There is a lot of mental and emotional stress that you undergo too.
Yeah. So first of all, what I always try to say to my patients is that from the time of the diagnosis till they have all the treatment and everything, till they feel normal again, or till they feel back to normal again, it's approximately a year.
Yeah.
It's approximately 10 months to a year. Yeah. Because you have to undergo surgery, you have to undergo chemo, maintenance therapy. So patients, when they are prepared, I think when patients are adequately coached from the beginning and know what to expect, it's always better if you know your enemy and you know the journey to tolerate it better. Yeah, so
Yeah.
it takes approximately a year. Take advantage of the psycho-oncologists we have, of the clinical nurse specialists we have, to talk to them, to get help. We have in the UK brilliant CNS nurses, so clinical nurse specialists, that again do not exist in Europe because of the centralization of care here. We have psycho-oncologists who are dedicated only for gynec cancer patients. So we have many options that patients can take advantage, can use. Don't be disappointed by yourself. Don't expect too much. I always try to say to my patients, you know something, if you have a rubbish day, just accept it. Say, it is a rubbish day today, and I celebrate this rubbish day. I allow myself to have a rubbish day. Don't try to be brave always. You don't need to always try to be brave. Everybody is allowed to have bad days and good days, and the same applies with patients.
Absolutely. No wiser words have been said. Having navigated the journey myself, I think that was one of the biggest struggles was, and I don't know, Liam, if this was something that Anita coped with as well, is just, keeping yourself motivated, being easy on yourself, because you don't, like you say, every day is not going to be a good day.
Exactly. And we as women, we have a much higher, I'm so sorry now to say that, criticism against ourselves. We always say, God, we are not enough. We haven't done our best. And we also as patients do the same and say, oh, no, we have to be brave. No, you don't have to do anything. You don't have to. Yeah.
You're allowed a bad day.
Exactly.
Oh, it's been absolutely wonderful speaking to you both. I really do. It's been informative. It's been really, really interesting and really informative. I'm really thankful to you both. Thank you so much, Liam Desai, and thank you, Professor Christina Fatopoulou, for giving me your time, sharing your thoughts, and you've done it so, so generously. Now, if you would like more information on ovarian cancer and the work of the Ovarian Cancer Coalition, then just head on over to their website. It's all the W's, World Ovarian Cancer Coalition. Don't worry, there's still lots more to be coming up this afternoon on the Instagram Live. I know we had technical difficulties, but we've made good of a bad situation, and we still managed to be able to speak to Liam and Professor Fatopoulou. Thank you all so much, and thank you both of my guests. Really value and appreciate your time. Thank you.
It was amazing to be with you. Thank you so much.